When your blood sugar levels are higher than normal but not high enough for a diabetes diagnosis, it's called prediabetes. What's alarming is that more than 80 million people in the United States alone have prediabetes, and many of them don't even know it. If left untreated, prediabetes can progress into type 2 diabetes, a condition that significantly increases the risk of heart attack, stroke, kidney disease, nerve damage, and other serious complications. The good news? Prediabetes doesn't have to turn into diabetes. By recognizing the symptoms early, you can take action to reverse it through lifestyle changes and medical guidance. In this video, we're breaking down the top 10 symptoms of prediabetes. The final one is the most important, and one you absolutely need to know about, so be sure to watch until the end. 1. Blurred vision. Blurred vision is often associated with eye issues like cataracts or migraines, but it can also be an early sign of prediabetes. High blood sugar levels pull fluid away from the lenses of your eyes, affecting their ability to focus properly. This can result in temporary blurriness that may come and go as your blood sugar fluctuates. Key tip: if you notice persistent blurriness, schedule an eye exam and discuss your symptoms with your doctor. Early intervention can prevent long-term damage, including diabetic retinopathy, a serious complication that can lead to blindness. 2. Fatigue. Do you feel exhausted even after sleeping well? Fatigue is a common symptom of prediabetes because your body isn't processing glucose effectively. Glucose is your primary energy source, but when insulin resistance develops, your cells can't absorb it, leaving you feeling drained no matter how much rest you get. Key tip: if fatigue is affecting your daily life, monitor your eating habits and energy levels. Reducing sugar and processed foods can stabilize blood sugar and improve energy. 3. Unexplained mood swings. Your mood and mental clarity are closely tied to your blood sugar levels. When glucose levels are unstable, it can lead to irritability, anxiety, or even feelings of depression. If you're experiencing mood swings along with other symptoms, it could be a sign of prediabetes. Key tip: balanced meals that include protein, fiber, and healthy fats can help regulate blood sugar and stabilize your mood. 4. Excessive thirst. Constantly feeling thirsty is another major warning sign. High blood sugar pulls water from your cells to dilute the excess glucose in your bloodstream. This triggers your brain to signal thirst as your body attempts to rehydrate. Key tip: avoid sugary drinks like soda and sweetened juices, as they can worsen dehydration and blood sugar levels. Stick to water or unsweetened beverages. 5th, frequent urination. With all that excess glucose and water being processed, your kidneys have to work overtime, leading to increased urination. If you're running to the bathroom more often than usual, especially at night, it might be time to check your blood sugar levels. Key tip: frequent urination can also lead to electrolyte imbalances, so consider incorporating electrolyte-rich foods like bananas or avocados into your diet. 6. Excessive hunger. Are you eating more but still feeling hungry? This can happen when your cells are starved of glucose due to insulin resistance. Your brain mistakenly interprets this as hunger, even though you've eaten plenty, leading to overeating and weight gain. Key tip: focus on high-fiber, low-glycemic foods like vegetables, whole grains, and legumes to keep you fuller for longer without spiking blood sugar. 7. Achy joints. Joint pain isn't just from arthritis. It can also be a symptom of prediabetes. Excess body weight, often tied to prediabetes, puts additional stress on your joints, causing inflammation and discomfort. Over time, this can lead to more serious issues like osteoarthritis. Key tip: regular low-impact exercise like walking or swimming can help reduce joint strain and improve your overall health. 8. Slow wound healing. When your blood sugar levels are elevated, your body's ability to heal is compromised. High glucose thickens your blood and slows circulation, making it harder for nutrients and oxygen to reach injured areas. If cuts, scrapes, or bruises are taking longer to heal, it's a red flag. Key tip: keep wounds clean and monitor them closely. If healing is delayed, consult a healthcare professional. 9. Tingling or numbness. Tingling or numbness in your hands, feet, or legs can be an early sign of neuropathy a condition caused by prolonged high blood sugar. This nerve damage develops gradually, but early detection can help prevent it from becoming permanent. Key tip: staying active and maintaining healthy blood sugar levels are crucial to preventing neuropathy. 10. Dark skin patches. The most important symptom to recognize is dark patches of skin, especially in areas like the neck, armpits, or groin. This condition, known as acanthosis nigricans, is a direct result of high insulin levels and is a clear indicator of insulin resistance. Key tip: if you notice these patches, consult a doctor immediately. Early treatment can reverse prediabetes and prevent further complications. At what point does prediabetes become diabetes? When blood glucose levels reach 126 milligrams per deciliter or higher, prediabetes progresses to type 2 diabetes. This transition typically takes between 3 to 10 years, but can happen faster or slower depending on lifestyle factors like diet and exercise habits. The good news is that during the prediabetes stage, the condition can be reversed with professional guidance and lifestyle changes. However, once it develops into chronic diabetes, it cannot be cured, and management relies on medication or insulin. What is the treatment for prediabetes? To treat prediabetes, the first step is to see a doctor who will diagnose the condition through blood tests. The main treatment approach includes adopting healthier eating habits, such as cutting down on sugar, unhealthy fats, refined carbs, and salt. It's also important to focus on nutrient-dense foods like leafy greens, whole grains, legumes, and low-fat dairy. Physical activity is another key factor. Regular exercise helps the body use glucose more efficiently, reducing insulin resistance and preventing the onset of type 2 diabetes. By following these medical recommendations, individuals can normalize blood sugar levels and potentially prevent prediabetes from developing into full-blown diabetes. Adopting these lifestyle changes not only prevents the progression to diabetes, but also improves overall quality of life. It's essential to maintain healthy habits long-term to keep blood sugar levels stable and avoid complications associated with high glucose. Take action today. If you've experienced any of these symptoms, don't ignore them. Prediabetes is your body's way of warning you. It's time to take action. Through a combination of healthy eating, regular exercise, and medical guidance, you can reverse prediabetes and reduce your risk of developing type 2 diabetes. Before you go, hit the like button if you found this video helpful. Share this video with friends and family to help spread awareness. And don't forget to subscribe to our channel for more health tips and life-changing information. Comment below, have you noticed any of these symptoms? What steps are you taking to improve your health? Let's talk about it in the comments. And as always, stay tuned for more health tips and hugs of positivity. Your journey to wellness begins with a hug.